Hello and welcome. My name is Laura Geer. I'm from the State University of New York out of New York City in the USA, from Downstate School of Public Health. I wanted to briefly take a minute to thank the organizers of this fantastic event and also thank my co-author of this presentation, Rachel Radigan, a recent master's student graduate at SUNY. I'm going to talk to you today about our cross-sectional study looking at healthcare students' perceptions of life during the pandemic. I partnered with Professor Baleon out of Pernambuco in Brazil. And this was a COIL partnership that was a collaborative online international learning experience sponsored by SUNY. And this is where she's located. I should have shown you New York City. Anyway, here's some of our survey development methods. Of course, we were implementing this module during the pandemic. We wanted to look at, with our students, different experiences during COVID, demographic drivers, cultural influence on risk and protective behaviors, social environment perceptions, influences on mental health, symptomology and illness experience, and COVID-19 characteristics and response. So we implemented the survey with graduate students in both of our classes by email. What we found regarding protective behaviors is that 88% reported proper PPE use, 76% of students in the US reported no known risk factors for the COVID-19, and 86% of Brazilians reported no known risk factors. But when they did report risk factors, asthma was the highest reported in the US, so students reporting having an underlying condition. And then overweight or obesity was reported as the highest in Brazil, or 11%. So some of the most important risk factors reported by these students, and note these are healthcare students and highly educated on the pandemic. So crowded places, the students reported, being around people without masks, closed places without ventilation had a high yes response rate, some of the risk factors that we know about for transmission, as well as some did report contaminated shopping items, being a small percentage contributing, and our perceptions about that actually changed during the pandemic as more information came out about the risks. So in terms of social environment and mental health, take note that all students were engaging in online learning at the time, and 81% reported having reliable internet. In terms of social relationships, many reported no difficulties. So the majority reported no difficulties, lack of time being the most common reason. In Brazilian, students reported lack of volition to socialize due to mental health complications in maintaining social relationships. I'm going to zip to the end here. I'm running out of time. So cultural and social differences, risk messaging, and lifestyle factors may contribute to disparities in perceptions and behaviors of students around the coronavirus. And these definitely have implications for global infectious disease. Results can be instructive for universities, local governments, and health departments in strategizing for risk messaging and dissemination. So please do visit our poster, and I'd like to acknowledge all of the co-authors, including in particular the folks from UFPE Brazil, our co-authors and collaborators. So thank you kindly.